Welcome back, everyone. Experts say many new or expecting mothers skip out on critical care early on in their pregnancies or after their baby's born. According to United Healthcare, nearly 1 in 4 women do not begin prenatal care in the first trimester, and nearly 40% skip postpartum visits altogether.
That is part of why July is recognized as Postpartum Changes Awareness Month. For some more insight today into what growing families should expect and what resources are available for them, let's bring in Nancy Parson. She is the Vice President of Clinical and Quality Operations at United Healthcare. Nancy, welcome in and thanks for being with us.
Thanks for having me.
First, talk to us about what's behind some of those statistics that we just mentioned. Why aren't more expecting or new mothers seeking that kind of care?
Well, whatever the reason someone is not going to prenatal care, I really want to encourage you that as soon as you find out that you're pregnant or you suspect being pregnant, the first thing that you should do is call your doctor and schedule an appointment. Getting in to see the doctor early and having regular prenatal appointments are really going to help the health of the mom and that unborn baby.
We know very early on in someone's pregnancy, or maybe even after giving birth, many moms are so focused on the health of their child, the last thing they may be thinking for is actually caring for their own body and recognizing the link in those two things. So what does that prenatal and postpartum care really look like? If you could pull the curtain back, what types of things should they be expecting in those appointments, and why are they so important?
So during the prenatal appointments, like your very first appointment, the doctor's going to get a health history of you and find out if there's things going on in your health that will impact the pregnancy so that they can work a pregnancy plan that works best for that individual. And so maybe there was a history of like substance use or opioid use. Those things are really important to tell the provider so that they can work that pregnancy plan for you. You may be seen on a monthly basis where the doctor's evaluating how the size of the baby, how the baby's growing inside of you. As you get further in your pregnancy, some of the appointments may be every 2 weeks or every 1 week towards the very end. And then after the baby's born, it's also very important to see the doctor between that 3rd and 12 weeks. Because you need to make sure that your recovery is going well after delivery, that you're doing well, the baby is healthy. After delivery, there might be questions about breastfeeding support, ensuring that you have a healthy diet, that you're drinking lots of water. All of those things are just critically important. And as a maternity nurse, I've seen hundreds of patients throughout the years. And the most important thing I can say is go to your prenatal appointments early and ensure that you are also seen in that postpartum period.
Well, there is also a growing focus on how things like doulas or non-medical birth partners can help. Explain how those work, and is there any research on how that can help impact outcomes for new parents?
Yes, a doula is like a labor coach. And so a doula is someone who's educated on everything about a pregnancy, the labor, and postpartum. So the doula is not the one who actually delivers the baby. However, they can be there for you during your pregnancy period. They can go to appointments with you if you want them to. They're there as a support for you, an educational resource throughout your pregnancy. During labor, they can be there to help you with breathing techniques and just be another extra support person for you. And then during that postpartum period, a doula can help you with breastfeeding, help provide education about your health and wellness. Sometimes in a postpartum period, a mother may sometimes feel a little bit sad or even a little depressed. And so some of that is hormonal changes that are normal after having a baby. But that's why it's also important to see that doctor during the postpartum period so that you can be assessed for postpartum depression and see if that's something that your provider needs to work a plan for you.
So tell us, for folks who may be interested in a non-medical birth partner, a doula, or just jumping into some prenatal or postpartum care that they have not been doing, how much of these types of resources and services are covered by insurance versus what someone may have to pay out of pocket?
I can speak on the Medicaid side. I work with United Healthcare for Medicaid. And so we do cover the provider visits, of course, and then we also do cover doula support. And so if you're interested in having a doula, that is something that is covered. Our Medicaid plans and most, I'm in New Mexico, but the Medicaid plan here provides transportation to and from appointments. It'll provide transportation to like a birthing center or a food pantry. And so there's a lot of benefits that way that your Medicaid plan may have. And so I would encourage you to look to see what your insurance covers. And, if by chance you don't have a doctor at this time, then it's important for you to, if you have an insurance card, call the number on the back of the insurance card, or you can call your local health department or the Medicaid provider in order to get a provider so that you can get seen.
Well, Nancy Parson with United Healthcare, we appreciate you taking the time and for joining us today to talk through this.
Oh, no problem. And thank you for having me. There's a website that you can go to, everypregnancy.com, and on there, United Healthcare has a healthy pregnancy quiz that you can take so you can find out what knowledge you already have and what information you want to know more of. And so again, that's everypregnancy.com. And United Healthcare wants to be there to support you and the baby every step of the way. We want you to have a healthy pregnancy, healthy delivery, and of course, to have that health of the baby after delivery.